Thank you to everyone who lasted the entire day. I see people leaving, and that's perfectly okay. It's been a long day, but we really appreciate you being here, and to our virtual audience. Before I start the final presentation, which is mine, about me, I guess, and the foundation, just wanted to quickly say thank you again to our sponsors. That's Amgen, Alexion, UCB, Genentech, and Euroimmune US, without whose support this would not be possible. Our fabulous ambassadors, Kayla, Marion, and Nikisha, the panelists, the doctors, the patients, the caregivers, everyone who's here, Addison, and all our new friends. So thank you so much. So again, my name is Sumaira. I am a patient living with seronegative neuromyelitis optica. I am going to fly through this presentation because I'm sure everyone's very, very tired and I don't want to bore you. But yeah, I guess let me tell you a little bit about my story and about me if you don't know who I am. So first, until April 8th, 2024, my favorite part of my life was the foundation, and it will always be one of them. But I became an aunt on April 8th to this beautiful baby girl, Mahmoud Ahmed. I'm obsessed with her. I'm crazy about her. This is the first time I'm an aunt, and she fills parts of my heart and my life that I could have never, ever, ever imagined. So this is her. She's a lot of people say she looks like me, which I think is the best compliment ever. But yeah, that's my sweetheart. I actually missed AAN this year because she arrived 16 days early and surprised us all. We named her in December. My family really feels some kind of I guess, connection to the moon, and my mother's name is Moon, but she actually was born early on Eclipse Day. So I think she's a very rare, fantastic baby. Of course, I'm biased, but that's my baby girl. And now it's back to business. So these are pictures of me, actually, when I mean, I'm still a patient, but when I was really in the acute stages of NMOSD and getting diagnosed. So I was diagnosed with NMOSD in August, actually. Then it was NMO, it was SD, had not yet been added, but I was in the hospital all the time. I lost significant vision in my right eye and then my left eye, and then I couldn't feel the left side of my body. Because I had said earlier, I live in Boston, I worked in healthcare. I was very lucky to get diagnosed within 4 weeks of my initial symptoms. And obviously, at 25 years old, becoming blind, not being able to walk, and losing, you know, I felt like I lost everything. I was very depressed, and everything I saw on the internet was horrible. So I took to my blog, and I had written about what happened to me. And part of it was also because there were so many people from all walks of my life that were wondering, like, what happened? Why is Sumaira in the hospital? She's one of the healthiest people we know. I used to be very, very fit. For those of you who don't know, prior to illness, I was a dancer for 21 years. I was also in the entertainment industry. I was trying to be an actress in Bollywood and all that fun stuff. So anyway, people were very curious about why was I in and out of the hospital. So I blogged about what had happened to me when I got diagnosed. And overnight, my blog received 100,000 views or something crazy like that, which even today in 2024 would be a lot for me. So that kind of gave me this idea. I said, hold on. Maybe this happened to me for a reason. Maybe I have a PR degree that could be used for something good. Maybe I trained how to be in front of a camera and on stage and do interviews for something other than acting. Maybe I worked in healthcare and had all the right connections for this reason. And someone very close to me sent me this quote that totally resonated at the time. From R.M. Drake, there was a flower in her heart, it just needed more room to bloom, and when she let it free, she showed the world that sometimes the most beautiful things can grow in the darkest of places without the need of light. And having lost 70% of my vision at the time, this really moved me, and I said, you know what? I'm not going to die from this because nobody knows about it. I'm not going to let other patients who are far less luckier than I am around the world suffer in silence and alone. So I'm going to do something about it. So this is an article from the Boston Magazine on September 10th, so just 1 month after my diagnosis. I announced to the world that I was going to do something about this. And so we launched this, well, I launched the Sumaira Foundation at the time. I will say I was a one-woman show for about 6 years. And we are dedicated to illuminating the darkness of NMOSD and MOGAD and now other rare neuroimmune conditions. We are 10 years old this summer, and I've also now been living with this disease for 10 years, which is amazing because, as we all have established, everything on the internet told us we weren't going to make it past 5 years. So I'm really happy to be here, be with all of you, and I'm happy for all of us. So who are we? What do we do? We have 4 pillars. They are awareness, community, advocacy, and research, patient-powered, patient-led, science-driven, therapy-agnostic. And this is a picture with Connor Judge and Chelsea Judge from pre-pandemic days, but I wanted to put this up here because today really wouldn't have been possible without the partnership and trust that we have gotten from the Connor B. Judge Foundation. We officially merged with them a couple of years ago, and they were the ones who made the introduction to all of these fantastic doctors in Cleveland. So we're really happy to be continuing the legacy of Connor B. Judge Foundation in Ohio. So this is our leadership team. We're pretty global. So you see me, Michael, and Jill here. That's Guillaume. He's based in France. Stephanie in Canada. Jasmine in, where's Jasmine? California. And then Chelsea, who's in Ohio. The ambassadors, which I would say are the pride and joy of our foundation, come from 28 countries. So we've got 75 ambassadors from 28 countries who speak 24 languages, 87% of whom are women. That makes sense because NMOSD, at least, tends to affect more women than men. We have 10 caregiver ambassadors, 2 pediatric ambassadors. Addison, I'm going to add you to our team and make you the 3rd. And we've got actually 12 clinician ambassadors now. And as you can see from our stats on the right, diversity is very important to our organization, but most certainly to me as the leader of this organization. I am a woman of color, I am a child of immigrants, and I believe that whatever we do, we should be doing for everybody. These are some of our beautiful ambassadors from all around the world. It's very important to me that anyone who looks at our site or looks at our social media can relate to someone on there. So whether you look like someone or you speak the same language as someone, this is super important for inclusivity. So illuminating the darkness. Because we're in a small room here with not so many people, I'll let you in on a little secret. I actually came up with this slogan when I was on morphine soon after diagnosis, and it stuck, and it still remains, and it makes a lot of sense to me. So I chuckle a little every time I see it. Voices of NMO. This was our first program that we launched in December 2014. Now, 10 years later, it's still in existence. It's our longest standing program. We have Voices of NMO and Voices of MOGAD, and we've shared about 175 stories from across the world, from patients, caregivers, and clinicians. I tried to take my background in entertainment and weave it into my present life for a brighter future. So you'll see a lot of very cinematic things come out of the foundation. These are snippets from a PBS special we did a couple of years ago called Medical Stories. And in the middle here, I don't have a clicker, but that's Dr. Sean Pittick. He's at the Mayo Clinic. He's done a lot for NMOSD and MOGAD. We have been filming patient vignettes around the world for the last 2 years. This thumbnail is from one of our French stories called NMO Bonjour, and it actually went on to become a finalist at the World Health Organization Film Festival last year. We didn't win, but we were one of 90 finalists out of 800 submissions in the world. And in the category that we were in, there were 15 other contenders. We lost to a short film about Bangladesh, which is the country I'm originally from. So actually, I did win. So I feel really good about it. I love winning. Here are some of our programs. So From the Experts is our webinar series. We have webinars in 13 languages. We have a dedicated webinar series for Canadians. We have a podcast that's in its 4th season now called Demystifying NMO and MOG. And then we have a webinar series focused specifically on MOGAD and the importance of clinical participation, clinical trials and patient participation. We're very passionate about creating a global support network. I never want people to be alone and feel that isolation that I felt when I first got sick. So just as an example of what we do, we have 12 support group meetings in all of these different countries and languages. They are run by our ambassadors. So Yeah, India, Germany, Denmark, South Africa, UK, Turkey, Italy, Spanish, France, so all over the world. We've been doing these patient days, so I like to say I've been on my own little Beyonce tour since 2022. We were in Milwaukee, in Dallas, in LA, New York City, Verona, Italy, Paris, France, Boston, and now Cleveland. Our next one is in Atlanta next month, and then following that will be a part of the ECTRIMS Patient Day in Copenhagen, and then Beijing in September, and Miami in October. Here are some pictures from our patient day. So the group, I am so tired. The group picture that we took earlier will be added to this collage. If you didn't see, the unicorns are everywhere. They are our mascot, and whenever we find out about a child under the age of 18 who's been diagnosed with either NMOSD or MOGAD, we send them a care package with a unicorn, stickers, bracelets, a handwritten note from me. And without choking up, I will try to tell you the story of the unicorn. So in 2019, I became aware of a pediatric case in New York, rural New York. The family reached out to me they were very worried about their 6-year-old daughter who has NMO, and they didn't speak English. So of course I was like, let me see what I can do. Who can I talk to? Whatever. So long story short, we arranged for the little girl to be medvaced or transported by a helicopter to Boston Children's the next day or 2 days after, something like that. And the night before she was going to get transported, she had passed away. Yeah, yeah. I would say in my career of advocacy, that's to this day the biggest blow of my life. I really, it's very difficult for me to talk about it, but it really moved me because children should not be sick ever. And children being sick is unacceptable in my opinion. But we can't be losing kids to these diseases. We have to do more. So it lit a fire in me that I can't live with myself and not do something for her and all these other kids around the world. So in her honor, we created a pediatric research fund. Her name was Joannie, so it's called the Joannie's Unicorn Grant. And we made our mascot the unicorn because she loved unicorns. So when you see them, they're for her. Sorry. Sorry, moving on. Lots of tears today. Wasn't expecting that. So, happier stuff. We now have approved therapies for NMOSD. This is so wonderful because we didn't have this before. And I feel it's my responsibility as an advocate and a patient leader to just disseminate as much information as I can to you guys. So one of the projects I'm most proud of with the foundation is this approved therapies chart we have on our website. It's an interactive therapies chart with animations, voiceover, side by side, all the therapies, outlining in the most simplest of terms, what are the side effects, what is the dosing, what is the frequency, what is the drug delivery method, is there a copay assistance program for this, et cetera, so that patients and caregivers can make informed decisions about their long-term treatment plans with their physicians by way of shared decision making. So if you haven't yet seen it on our website, check it out. And my hope is that when MOGAD treatments are approved, we will have the same for MOGAD. We work with several patient assistance organizations in the U.S. to help with a variety of expenses related to medicine, your medical care. So PAN Foundation, the Assistance Fund, Good Days, and NORD. March is NMO Awareness Month. April is MOGAD Awareness Month. These are the busiest months of our year. These are some illuminations from around the world to recognize TSF's NMO and MOGAD Awareness Month. So you see Niagara Falls, an arena in Italy, the Zakim Bridge in Boston, the Empire State Building, the oldest hotel in Denmark, and the CN Tower in Toronto. We do proclamations on a year-to-year basis alongside many other patient advocates to get states to recognize NMO Awareness Month as well as MOGAD Awareness Month. This is a photo from the European Parliament, and that's our Belgian ambassador, Els. She presented to the European Parliament about why the early detection of rare diseases can actually save lives. This is a few of us ambassadors in front of Capitol Hill for Rare Disease Week on Capitol Hill last year. We actually saw the president, which was kind of crazy. We started funding small research grants in 2018. So since then, we have funded 32 projects in the amount of $750,000. If I had more money, I'd give it all away to research, but this is what we could do for now, and hopefully this year we can reach the $1 million mark. We recently funded the publications of 12 articles focused on MOGAD in a journal called Frontiers in Neurology from 9 countries. Myself and the foundation have a very soft spot for supporting research in lower middle income countries. Just to give you a frame of reference, to publish an article in a journal like this costs $3,500 per article, and in many countries, doctors don't even make that much a month. So if we can sort of step in and help these researchers who are working so hard on their research to get the word out, then we're happy to do that. We recently launched a program to summarize research in patient-friendly terms, because I'm not a science person. In fact, science was like my worst subject in school, so it's crazy that I work in neuroscience now. But this is really for people like me who don't understand all the difficult jargon and who want to understand all of the, what's happening in the research world. So we have a lovely team who works on this, and you can go to our website and look up articles that have been sort of summarized for diagnosis, disease overview, epidemiology, long-term outcomes, quality of life, and treatment. These are all the languages that our website is available in. I love languages. I can speak a few, but as we continue to expand across the globe, I'm getting more and more itches to learn more languages. Right now, I'm learning Italian, and c'è molto difficile, definitely. We are global, so we have legal entities, of course, in the US, but in Canada, in Germany, in France, in Italy. We're expanding to Saudi Arabia. We recently supported the Latin American Consensus for Treatment of NMOSD. This is a guideline for the entire continent so that they can streamline diagnosing and treatment. We launched a case discussion and lecture series in Iran, so this is virtual, and it brings together all of the neurologists in Iran, or Farsi-speaking neurologists around the world, to talk about a variety of different cases and topics related to NMOSD and MOGAD. This is a billboard from Shanghai last year during China NMO Day in partnership with our Chinese patient advocacy organization partner, NMOSD. This is a picture from ECTRIMS in Milan. You probably don't know who these women are, but they are movers and shakers in the world of NMOSD and MOGAD. Just some of them, of course, Dr. Amy Kunchok is here too, and Kelsey, but yeah, these are researchers from all over the world who are working on NMOSD and MOGAD day in and day out, so love them. Girl power. We launched a global diagnostics initiative, so the idea behind this is there's going to be several initiatives under this umbrella, but really it's to help diagnose patients around the world. We take for granted how many amenities we have in this country. Of course, healthcare isn't perfect here, but we can access things if and when we need to, even if it's with a fight. There are countries in the world where they don't even have access to tests. So people are getting sick and blind and paralyzed, and they don't even know what they have. And the doctors don't have the ability to test them, not because they don't want to, but because there's just no access to them. So we're hoping to sort of bridge the gap between, to get countries around the world NMOSD and MOGAD tests. Part of that initiative is our diagnostic fellowships. So these are short-term fellows that we send to the University of Oxford in the United Kingdom to learn from a very, very smart guy named Paddy Waters about all kinds of diagnostics. I'm not going to say the science because I will definitely mess it up. But the idea, it's a train-the-trainer model. So the idea is that they learn from this genius, and then they go back to their home countries and set up a lab and are able to diagnose patients in their countries. So far, we've graduated a doctor from Iran and 2 from Sri Lanka. And we have just welcomed our first long-term fellow, actually in Boston. This is Dr. João Oliveira. He's from the University of Sao Paulo in Brazil, and he's spending a year with us, and Michael Levy and Marcelo Mattiello, with a special focus on seronegative NMOSD. And last but certainly not least, we have soft launched an app. There are cards all over the table. We would love for you to download it, try it, let us know if it's working, if it's not working, is it useful, is it not? But we're still in learning mode, so we'd appreciate everyone's help in trying to understand if this is useful or not. It's called NeuroSum. Should I tell them the story of the name? Okay. And this is how to connect with us. Thank you all so much for coming, and I hope you had a fantastic day.